Good morning, everyone. Thank you so much for your patience and welcome to our Mothers and Babies webinar. My name is Crystal McCauley, and I would like to welcome you on behalf of the 2020 Mom team today. We are going through an overview of the Mothers and Babies postpartum depression prevention model. 2020 Mom's mission is to close gaps in maternal mental health. To that end, we are always interested in building up evidence-based treatment and prevention models to increase referral pathways. Mothers and Babies was originally designed as a 12-week face-to-face group postpartum depression prevention intervention model for ethnically diverse, low-income perinatal women, and it's effective in any population and can be used as a treatment program as such. Our team would like to thank Palo Alto University for their support of today's webinar, which is being led by Palo Alto Associate Professor, Associate Director of Clinical Training, and 2020 Mom Board Member, Dr. Ellen Barrera. Thank you so much for your time today, Dr. Barrera, and for all of your support of the Mothers and Babies model. Just before we get started, I would quickly like to invite each of you to go over to your chat feature on the GoToWebinar control panel and just send us a quick message and let us know either your profession and or why you've joined us today. We'd like to have a poll of the group, and then I will turn it over to Ellen Barrera. Thank you so much.
Great. So I guess I'll get started. So first of all, thank you for inviting me to share a really brief overview of the Mothers and Babies course. And you've said some of the things I was going to say, which is great for time management. So thank you for that, Crystal. So I'm Ellen Barrera. I'm really happy to be here to share some of the work that I'm doing, as well as some of my colleagues who have dedicated their research programs and their clinical work to reducing maternal mental health disparities using the Mothers and Babies course. So just to start off, I would like to just give you an overview of what I plan to cover today. So first of all, I will explain in a little bit more detail what the Mothers and Babies course is. I'll talk about the different adaptations that have been made to the Mothers and Babies course to fit different populations as well as different modalities. And then I'll talk some about the prevention intervention approach to using this and how this might fit your community, and making sure to save some time at the end for some questions and hopefully some good answers for you all. So just to start off, the Mothers and Babies course is based on a cognitive behavioral therapy approach. It does integrate social learning theory and attachment theory, and I'll try to highlight some of those aspects of it when I go through the specific lessons and the specific skills that we teach. It does use a prevention model approach, which is for women who don't meet criteria for depression in this particular case at the time, but who might be at high risk. The goal really is to reduce the onset of major depressive episodes in women, especially high-risk women, and it's mainly been used in terms of empirical evidence. It's been used with high-risk populations. And we're also hoping to empower and teach the women how they themselves can manage these changes during and after pregnancy. So that's kind of like a very simple way of describing what the Mothers and Babies course is all about and what we try to do. Regardless of whatever modality that you're using, whether it's group or individual or online, this is the basic structure of the Mothers and Babies course. So the curriculum covers 3 core cognitive behavioral principles. It teaches women how to actively participate in creating a healthy lifestyle for themselves and the newborn infants. We typically start off with an introduction, and this introductory section of the Mothers and Babies course really is about psychoeducation, about maternal mental health, maternal emotional experiences that they may have had previously or currently. Women learn what it is and what it means to have these emotional experiences and how to get help if they want or need it. Then moving from there, we tend to cover how we think and how this can affect how we feel. And this, now we're getting into the principles of cognitive behavioral therapy. And women learn how to think in a way that is flexible, healthy, and balanced, and how to teach their babies and their other children to do the same. So this sort of modeling that we try to encourage them to do is an example of some of the social learning driven aspects of the intervention. Similarly, we are also very interested in encouraging of the moms to really think about ways to emphasize bonding and building healthy relationships with their babies. So that's sort of the attachment attachment-driven interventions. And both of those, the social learning theory and the attachment, you see that throughout the course in all of these different constructs that we're teaching them. The second area that we talk about with them is how our behaviors or what we do affects how we feel. And an example of that would be that we might teach them about doing pleasant or meaningful activities in their daily life, which can help them build emotional strength to deal with stressful life events associated with motherhood, and really helping them think about things that they used to do that they no longer do, or that is challenging for them to do, but that which brings joy, brings distraction from maybe some of their negative thoughts or the stresses in their life. The third area that we teach or talk about is the importance of relationships and how the kinds of relationships that women are having can affect how they feel. We cover how to obtain the support that they may need or that they may want, ways to lower conflict in relationships with the people in their lives. Again, we're also emphasizing building the relationship, the strong relationship with their babies, with their partners, and so forth. And then the intervention is wrapped up with an emphasis on planning and shaping of the mom and the baby's future. And what's really nice about, what I really like about the Mothers and Babies course at this point is that we tend to mark the ending of the curriculum with a nice graduation. Given that the Mothers and Babies has been predominantly used or at least tested in high risk, ethnically, racially diverse, high stress populations, there are some instances, and in many cases, many of the women that have taken part in the Mothers and Babies course have not graduated from anything before. So having this graduation, especially, for example, in the group format with other women who you've known for the last 12 weeks or 8 weeks, really marks a special moment for them. And so we really try to emphasize that with a really beautiful certificate that we give to them. And so it's a really meaningful aspect of concluding the intervention. Each of the different lessons or the constructs, there's some commonalities across the different skills that we're teaching. And I think that each of these things are really instrumental to the structure of the course. And so what you'll see here is that no matter what your modality or adaptation that you're using, each of the different lessons includes an overview. Self-monitoring of their mood is really important and something that we encourage them to do on a regular basis. Also, self-monitoring of the skills that they're learning is also really important so that they can begin to notice changes in their mood, changes in what they do or how they're thinking or the people that they're interacting with. The key points and new materials, what I covered in the previous slide, and then encouraging them to engage in some relaxation, meditation exercises, as well as what we call personal projects, which is the work that we hope that they're going to do in between the sessions or in between the lessons. In cognitive behavioral therapy, that's usually referred to as homework, but for many of the women that we're working with, homework doesn't have the same positive or any meaning to them. So we really talk about it within the context of practice and personal project and building that self-efficacy to implement the skills. One of the things that I think is really also nice about the Mothers and Babies course, and this may be true or more true for the adaptations where it's more in a group format or with home visitors, is the level of perceived social support received and perceived by the women in each of the program, in all of the different programs. So even though, even though this isn't like a social support kind of framework, there's definitely a lot of social support that's given or received. And we even see this in some of the digital forms of the Mothers and Babies course. So I think that that's just a nice aspect of this particular model. In the next few slides, I'm going to go over, this is just a quick summary here, but I'm going to go over the different adaptations of the Mothers and Babies course. I will present some of the evidence, the research evidence to support each of these different adaptations. And then I'll also include a slide that includes the individuals who have expertise in these different areas in case you want to reach out to them or look into their work a little bit more depending on the different format that you might be interested in. So I'll start off with the group format, which was the original design of the Mothers and Babies course. I'll talk some about the home visitation adaptation, and then I will conclude with some of the more recent technology-based adaptations that I've been working on as part of my work. So just to start off, the Mothers and Babies course was originally developed as a 12-week course, a group format. They would meet for 2 hours for 12 weeks. It included 4 booster sessions, which would occur during the postpartum year to address issues that come up during that first year. This is a screenshot of the original manual, which has been translated into Spanish, English, and Greek. Most of the manuals or the different versions of the Mothers and Babies course also include an instructor manual, which I think can be really helpful, especially when learning how to implement the Mothers and Babies course or when considering the differences in your setting and how you might adjust it to fit your community. So as Crystal mentioned, the Mothers and Babies course was really developed by Ricardo Munoz and his colleagues at UCSF. That's where he was at the time, the University of California, San Francisco. And in the initial pilot randomized control trial, which was conducted with pregnant English and Spanish speaking high-risk women at an OBGYN clinic, what they noticed is that the rate of postpartum depression among women assigned to the Mothers and Babies course was lower relative to those who did not receive the Mothers and Babies course. So if you're interested in accessing and learning more about this particular version of it and also previous depression treatment and prevention interventions that really laid the foundation for the Mothers and Babies course, I encourage you to visit the i4Health website at Palo Alto University, which is where Ricardo Munoz is currently. Mimi Lay, who trained with Ricardo Munoz and who is now at George Washington University, it took the 12-week course and adapted it to an 8-week and to a 6-week curriculum, keeping the group format, and then also reducing it to 3 booster sessions. The participant manuals are available in Spanish and English as well. The instructor manual typically is only available in English. But if you're interested in that reduction of the weekly sessions, this would be where you could access those manuals. One of the reasons or the motivation for reducing the number of sessions was really because, as we know, pregnancy is a time-limited experience, and really wanting the women to be able to complete the course as much as possible during pregnancy. So both the 12, 8, and 6 week are really designed for pregnant women, even though the skills being taught can be applied to postpartum women, really wanting them to develop and practice those skills earlier on, which is also part of a prevention framework. So evidence from a pilot randomized controlled trial, which was conducted among low-income Latinas in the Washington, D.C. area, who were recruited from a community-based prenatal care clinic, showed that fewer women who were in the Mothers and Babies course reported moderate levels of depression after the intervention was complete. So additional evidence to show that this particular modality, the 8 and 6 weeks, could be effective for impacting depression during the postpartum period. So using the 6-week curriculum that Mimi Lay adapted, Deborah Perry, Darius Tandon, and Tamar Mendelsohn, who at the time were at Johns Hopkins University, adapted and implemented this group format into home visitation programs in the Baltimore area. The home visitation programs that they tested it in predominantly served high-risk African-American women. And what's different about this particular trial is that they included not just pregnant women, but they also included mothers who had infants less than 6 months in age. And what they were able to find in their study is that there were fewer new cases of major depression and reductions in depression symptoms among the women who were enrolled in both the home visitation and the Mothers and Babies course. And in addition to that, women in the course were also able to report improved ability to regulate their mood, which is one of the goals of the Mothers and Babies course, is really to teach these skills so that they themselves can begin to implement and apply what they're learning in the group or what they're learning through the course into their daily lives. Building on his work with the home visitation programs, Darius Tandon, who's now at Northwestern University, went on to develop the MB one-on-one. And this adaptation is taught by home visitors and delivers the core content of the 6-week group, but in 12 individual brief sessions. This particular format of the Mothers and Babies course has been translated into other languages as well. And data from his earlier studies and current studies show that women enjoyed and easily understood the course material. They found it to be useful. In addition to that, the home visitors were able to implement the intervention with high fidelity. And in a randomized controlled trial, what he was able to find was that there were significant changes in depression and anxiety symptoms at 6 months, and that there were also differences in perception of social support were noted amongst the women who received the MB one-on-one course. So additional evidence that this particular intervention can be effective at impacting depression, and in this case, anxiety to some degree. So now we're moving into a little bit of a different way of accessing the Mothers and Babies course, which is the work that I've mostly been doing, which is trying to think about how can we use technology to increase the access to the Mothers and Babies course. So about 10 years ago, I began to work with Ricardo Munoz. I was also trained at University of California, San Francisco. And one of the first things that I tried to do with the Mothers and Babies course, or that I did, was to adapt it to an online platform. And really my intention was just how can we reach more moms in the world, really. The internet was much newer and less sophisticated than it is now. So these are just some of the screenshots from that early version, which were very text heavy, and included some images there. So I developed the online, it was fully automated version. It was based on the 8-lesson course that Mimi Lay developed or adapted. That putting it on the internet was in some ways kind of mind-blowing at the time. We were able to reach a large number of women from all over the world who were interested in learning skills to manage and changes in their mood during and after pregnancy. It was available in English and Spanish as well. So what we found from this is that pregnant women with elevated depressive symptoms reported better depression outcomes when they engaged with the online version of the Mothers and Babies course relative to women who just receive a 4-page informational brochure. We weren't able to detect or to show statistically significant, prevention effects, but we were able to find that those women who were at highest risk for depression, meaning that they reported elevated levels of depression during pregnancy, and who engaged in the course had a lower risk of developing or of reporting EPDS scores above 10 during the follow-up period. So really at that time, what was exciting is that we were able to disseminate the course to women who potentially lacked access to resources or who were looking online just for some sort of support. And it really highlighted the strength of adapting things to a digital format to aid in the delivery of the Mothers and Babies course. Currently, what I'm working on right now is updating the Mothers and Babies course, and these are just some of the screenshots from the current version. It's under construction and almost done. It's been in that phase for a while, but I'm hoping that it truly is almost done. And so what you'll see is there's more images, there's audio, there's video, there's just more capabilities just to try to keep the women engaged in it as much as possible. So this next slide, if I can get it to work, is just a sample video that's included in the current version. So bear with me if I get it to work. Hi, I'm Dr. Lynn Barrera. Welcome to the Mothers and Babies online course. You probably decided to join the course because you are pregnant, just gave birth, or have young children. Many women attend prenatal visits or classes during their pregnancy that focus on their physical health and on the health of their developing baby. This course is similar, but we focus on taking care of your emotional health during pregnancy and after giving birth. Parents and caretakers are very important to the development of newborns and young children. They are the first teachers children have, and who go on to teach them how to eat, walk, and talk. Parents and caretakers also teach children how to be physically and emotionally healthy, and how to relate to other people. The Mothers and Babies course was developed for mothers, but the information can be used by others who are prominent figures in a child's life, like partners or fathers, grandparents, aunts and uncles, or any other caretaker. This course will focus on how you can become the kind of mother you want to be, and how you can raise healthy babies. Other women have found it to be helpful, and we hope that you will too. There are 8 lessons that are grouped into 5 areas. The first area covers emotional experiences that can sometimes happen to women during and after pregnancy. You'll learn what it is and what it means to have these emotional experiences, and how to get help if you want or need it. The second area is about how we think and how this can affect how we feel. We learn how to think in a way that is flexible, healthy, and balanced, and how to teach your babies and children to do the same. We then go on to talk about the impact of our behaviors as part of the third area. We share with you how our behaviors, or what we do, affects how we feel. Doing pleasant or meaningful activities, for example, can help build emotional strength to deal with stressful life events. In the fourth area, we talk about the importance of relationships and how the kinds of relationships we have can affect how we feel. We review how to improve our support and ways to lower conflicts that we sometimes experience with the people in our lives. We will also be wrapping up the main areas of the course during this lesson. Each area will include optional relaxation exercises. Some of them are guided recordings designed for pregnant women or new moms. We know that some of you may be familiar with this kind of activity or may want to return to it later, so we've put them all together in one area of the course. The materials of this course can be viewed in the order of your choosing, but we recommend that you focus on all of the materials within an area at one time. So that's just one example of one of the videos that we don't want to see that again. One of the videos that I've integrated into the online course as a way to supplement some of the more text-heavy material. And I try to use the videos actually to describe more the theoretical principles of the intervention, which I think can be really hard to convey in just text format. So I've jumped ahead here. In my attempts to keep up with the rapid changes in technology and to also continue to make the mothers and babies accessible to all different communities, women from all different backgrounds and with different levels of resources, a few years ago, I adapted the Mothers and Babies course to a text messaging platform. And I did this in collaboration with my colleague, Adrienne Aguilera at UC Berkeley, who created the Healthy SMS platform. And so we started off by initially developing 30 text messages that were sent out to community members to get their sense, to pregnant and postpartum women, to get their sense of whether they liked it or not. And then based on that is this current project that you're seeing described on this slide, where we're currently testing this in a community health clinic in Northern California, predominantly with Spanish-speaking pregnant and postpartum women. So in this particular version, what I wanted to do was I wanted to bring back some of the components of the face-to-face modality, so the group intervention and the home visitation, really bringing in a sense of community, because I think that was lacking in the first version. And so what we do now for this particular version of the baby text program, which is what I call the text messaging version of the Mothers and Babies course, is I have the 3 core principles, thoughts, activities, and contacts with other people sent as text messages, or what we call tips. And those are bookended by an introduction and a graduation group. So it gives us an opportunity to form a relationship with the women, to explain how this is going to work, to build that sort of justification, and then to bring them back and have a graduation. This is also based on the 8-lesson Mothers and Babies course, and although all of the materials are available in Spanish and English, we're currently only testing it with Spanish-speaking pregnant and postpartum women. So let's see, I think I told you about most of the results, but one of the things that I really enjoy about this particular project, despite its challenges, as all of these projects have, is this quote that we recently received from our first graduate of the program. So the quote here, for those of you who don't speak Spanish, I'll loosely translate what she said. So she basically said, "Thank you very much for your support. I'm so grateful and I'm so thankful for all of the advice I've received. It has helped me very much. May God bless you wherever you are and wherever you go." And then we have the international language of emojis, which doesn't really need to be translated. But I thought that this was just a really nice thing to receive, right? Any sort of reinforcement for the work and the challenges of doing this. And I also thought it really highlighted, one of the challenges that I often face because I work predominantly with Spanish speaking women and I use technology is the sense that, are they actually going to use the technology? And in fact, we find that they are using it, and it just makes it so much more accessible. And in particular, the clinic that we're working with, they don't have mental health services, or they're just starting to have some mental health services. So to be able to provide this low resource, both from the patient perspective as well as from the systems or the clinic's perspective, mental health resource is really invaluable to their patients, I think, anyway. So, I'm working with Darius Tandon, and I worked with Mimi Lay. All of us are kind of working together in our own different areas, but also together. And currently, Darius Tandon and I are collaborating on a study that is integrating text messaging into the excuse me, into the MB one-on-one home visitation program. This is something that's currently ongoing. And the messages that we're sending out really focus on skill reinforcement, homework reminders, or personal project reminders, and self-monitoring. So this is something that is really exciting that we're working on currently, where we're bringing together two different modalities of the Mothers and Babies course and seeing if this can also help improve and address some of the challenges that we've each experienced in our different modalities. If you'd like to learn more about that, I put the clinical trials link there, which is online and open to the public if you wanted to see more details about that. So at this point, you might be thinking, why this model and how does this fit with maybe your patient population or your setting or the community that you're working with? And I often like to use this quote because I think, I'm kind of biased because my work focuses on prevention, but I think as a field, we have seen, major developments in the quality of care provided by mental health workers or providers. Excuse me, I just drank some water. Excuse me. And then in the last century, we've really perfected our ability to diagnose, to identify methods to prevent disorders, to treat disorders. But in recent years, there have been several calls by national and international special task forces, committees, by large professional organizations that we really need to move our field into a space of innovation and develop interventions that can be adapted to meet the needs of diverse communities, to meet the needs of underserved communities. So I think that taking a prevention approach can be really helpful and thinking about in more creative ways, like how can we address these disparities that we keep seeing in a lot of the communities, and in particular around maternal mental health. When we think about prevention, there's currently limitations in effectiveness of treatment modalities for decreasing disability, due to mental and behavioral disorders. We have evidence that we can prevent, major depression, especially when we use CBT or other evidence-based interventions. I think that also psychological and social risk and protective factors and their interaction, which get very complex, especially in our more underserved communities, they've been identified, they've been documented, and many of them are malleable. So I think a prevention approach can really help with that. There is a large body of evidence to show that, there are effective prevention programs that can impact disease and reduce risk. So how can we strengthen protective factors to, help decrease the disability associated with mental disorders? And then related to all of that, effective prevention programs can be cost effective, and they can improve mental health in the long and the short term. So for me, those are the reasons that I always go back to why using prevention, because prevention work can be hard sometimes to convince someone who's not in the disease stage that they need to do something to improve their health. And in fact, most recently, many of you may already be familiar with this, but the U.S. Preventive Services Task Force recently issued a recommendation that, quote, clinicians provide or refer pregnant and postpartum women who are at increased risk of perinatal depression to counseling and interventions. And this is a nice little graphic that they put out in terms of who would be considered or who should we be recommending. And this was really based on some of the work that they did looking at different prevention interventions for postpartum depression. These are all the different ones that they looked at. And what they actually found is that out of 50 trials, they found that counseling interventions were associated with a lower likelihood of the onset of postpartum depression. And so there was a significant reduction in postpartum depression when, in most cases of these studies that they look at-risk women engage in these interventions. And my personal favorite reason for this whole presentation is that they highlighted two particular psychosocial or non-pharmacological interventions that had the most data, and the Mothers and Babies course was one of them. Of course, the other one was the Reach Out, Stand Strong Essentials for New Mothers, the ROSE program, which I encourage everyone to look into as well in case it fits your population better. But it was really exciting to see that the Mothers and Babies course was one of the recommended interventions from the U.S. Preventive Services Task Force, which also kind of builds some of the work that we've been doing for many, many years. So with that, I just want to thank you all for your attention and open up to some questions that I may be able to answer.
Thank you so much, Alin. That was very informative, and we thank you for your time. I do have a couple questions here I'd like to pass your way. The first question is, does the online or mobile platform of the curriculum allow for a psychotherapist who might be working with a client to view their progress or to follow them online through that mobile platform?
Yeah, that's a really good question. So for the Healthy SMS platform, which is the text messaging version, yes. And in fact, Adrian Aguilera, in his work that he's used it in, he has had providers, log in and track what the patients have texted back or how they're responding to the program. So that is a capability of the Healthy SMS program for sure. The online program, right now it's mostly it's in a research context, but there could be ways for providers to log in. So currently the way that it's set up when it gets launched is that users will have their unique ID and they'll have their unique login. And so you can probably set it up so that a provider could go in and look at their, particular patients and see how they're responding, or have it set up so that they send them, if they do a worksheet, they can send them a worksheet, or if they complete a lesson, they can say, so-and-so finished this lesson. I think it has those capabilities. It's just not set up that way currently.
Okay, great. Thank you very much for that answer. And the next question is, how can clients access the online course?
Yeah, so once it's done, it will be made available to anyone who wants to use it. And that's how, all of the material is framed with mom in mind or with a pregnant woman in mind. But eventually, we're still working on getting it live, working out all the kinks. And so once it's live, I'd be more than happy to share it with anyone who wants to use it, because one of my goals really is just to make it more accessible and more user-friendly, rather than having to download the manuals, which all of those manuals that I showed photos of can be downloaded and reviewed. But the technology-based ones are just nice because you can take it anywhere you are, really. So once it's all finished and done, I'll definitely share it with Crystal, and we can share it through this listserv.
Fantastic. Thank you so much. Couple questions in regard to sort of the same idea here, so I'll try to package it all together for you here.
Okay.
Is what sort of training do you recommend that people have in order to implement this program? Another piece of that was in specifically, well, yeah, let's just start with that piece. What training do you think people need to have in order to implement the Mothers and Babies model?
So I think that's an excellent question, and one that I didn't cover and meant to, but it is definitely in our instructor manuals that Mimi Lay, Ricardo Mendoza put together. So I think at minimum, I think someone who has had training in mental health in some way, whatever the discipline is, right? But that it has had training in mental health and how to deal with mental health issues is a critical training aspect of whoever's implementing it. Partially because even though we do use a prevention model, this can be used as a treatment model if your patient or your patient population is currently in episode or experiencing depressive symptoms. But in a prevention model, we still are confronted at times with more clinical issues that come up, and the instructor will need to know how to respond to those. Now, it doesn't mean that someone with less experience or who doesn't have a mental health background cannot implement or use this, but I would recommend, and I think others would agree with me, that someone who has had experience, for example, in the group modality, how to manage group settings with different people and characteristics, and how to manage that kind of environment. So some sort of group experience, or home visitors who have had experience implementing home visitation programs and knowing how to interact with clients in that modality, I think can be helpful. But I think having at minimum some exposure to mental health background is really helpful, because of what could come up in the groups, or what could come up even in the online version. We've had some participants who have used it and have felt more depressed, and we've had to address that from a clinical angle.
Fantastic. Thank you very much. Couple more quick questions here for you. One with specific regard to breastfeeding. Is this model does Mothers and Babies model encourage breastfeeding, or is breastfeeding or feeding addressed during the model?
It does not discourage it, for sure, but it's not included in the model. Health is really sort of more included more generally. The main emphasis is on mental health and well-being in that regard. So it doesn't include it. Although, there are ways that one could adapt or include different aspects of maternity health care into the model as it fits your population. But as it's designed, no, it does not.
Thank you. Wondering if there is a cost to providers who might want to implement this program.
Yeah, so I think depends on what you mean by want to implement it. So the manuals are available online for download. Anyone can download the actual, the 12, the 6, the 8-week manuals, the one-on-one, so those are all free of cost for downloading, as well as the instructor manual, most of them, if I'm thinking of all of them. There are training models to come for all of us in some way do training of different agencies or individuals who would like to become certified or more knowledgeable in how to implement the Mothers and Babies course into their community. And so I would definitely encourage, and there's a cost for that for sure. So I would definitely encourage you, if you're interested in that and receiving the training, it's very formalized and very comprehensive training. Then I would visit, either the Northwestern website. I would visit Mimi Lay's website at George Washington University. And then also that is something that, and I don't know if Joy, if you're on it, I can't look at the list, but that Joy and I have also been talking about rolling out as well. And those would have costs associated with it, given the time commitment associated with it.
Yeah, absolutely. And that's something that we're still talking about doing, offering something in person here in the coming weeks. So we'll be sure to send out any information we have on those to attendees today. And I think the final question I have, unless anybody wants to sneak another one in there, was wanting to assure that everyone would have access to the slides today. And the answer is absolutely. We are going to include them in a follow-up email and recording of this webinar that will come out to all attendees or registrants. And if you have any further questions, you can reach Lynn there at the email address listed. Also, the emails will be coming from myself, Crystal McCauley, and Joy Burkhardt at 2020 Mom, and we all look forward to staying in touch with you and supporting you as you go on to help mothers and families in your particular areas. Lynn, thank you so much for your time. 2020 Mom is grateful to have you as one of our board members and a leader in our support group program. And I know that you're going to do absolutely wonderful things. And we thank you for your time again.
Great. Thank you for the invitation. And thank you, everyone, for joining in this webinar.
Yeah, absolutely. Thank you all for your time and have a wonderful Thursday.
Thank you.